You mentioned, and both you and Celia have mentioned about, how things can be quite sort of normalized for long periods of time, and then there can be more of a sort of crisis mode. How does that switch gear for you, James? In terms of the emotional toll on that as well, and just, and also that kind of dynamic of being more husband and more caregiver, that sort of stepping in and out of that level of intervention that's needed.
Yeah, I suppose you've I sort of see it as you've got to do what you got to do. So at whatever time, so sometimes it does really ramp up, and it's something can happen very quickly. And if I'm in London or something, then I've had to come home very very quickly and be at home for a week, couple of weeks. We do also we do also rely on other family members as well, because with the degree of flexibility with work, with what I do, sometimes I can't be there. You have to, I have to be at work at certain points, and sort of pinch points, key points. And we do rely on others as well. But I suppose yeah, really sort of when it really does ramp up, I suppose you just go into almost survival mode.
Mhm.
We have dogs, we've got had just had a litter of puppies, and so we're doing the normal life stuff. But when something happens, we have to rely on a lot of other people, and we're very lucky in the fact that we do have lots of people that can come. And even things like let the dogs out, or we also had 3 ducks as well, and we had we had a big.
Why not?
Exactly, yeah, and we're hoping to get some goats soon too. But
No, we're not.
we
Celia says no, no.
exactly, yeah. So when just having that support network around you really helps as well. But as I say, it's just head down into survival mode and do what you have to do, really.
Do you ever have conflict, or kind of, when things then sort of go into remission, you're feeling a bit better, where you're still maybe being a bit over caregiving, if that's the right word, and
I
does
think
that
we
kind of
definitely
shift
did at
back
the
into that?
beginning. We definitely did at the beginning. And I think it's very difficult as well, because I think if you're somebody, especially if you're younger as well, and I say this, that not a lot of the conversation is around young people. When you're younger and you're just out of university or something like that, and you've got lots of ambitions for what you want to do, I'm massively conflicted between what my head wants and what my body wants. So my head goes, I'm going to do this, this, and this. I'm going to fire in every direction. I've got so much life left to live. Even if it's shorter, I'm going to do this, I'm going to do this, I'm going to go here, and I'm going to go there. And my body is kind of crawling itself along, going like, please stop. And my head won't do it, because I get that kind of frustration with myself. And we've definitely had conflicts where James has had to say, slow down. And then I go, why do you want me to slow down? Like, why are you trying to limit me? And all these kind of things. But it's because James knows what's going to happen if I don't. And that can be very difficult, because there's that relationship. It's like, okay, when does husband become carer again? It's that conflicting line again of, my carer is telling me to slow down because something's going to go wrong. But in that position, in the mentality I'm in, I'm here, my husband saying that, not my carer saying that. So it can be very difficult. And I'd say that's probably been like, in the beginning, was our worst line of conflict, wasn't it? Of like, we have to find a line where I need to recognize that when you're telling me to stop, it's because you know that I need to stop, and that I have to. But it's that little bit of loss of autonomy where, even about the decisions you're making in your life, you're relying on somebody else to kind of keep you in check, especially if you're kind of very driven about what you want to do. You're relying on that other person to kind of keep you in check. And that can be very difficult in a romantic relationship, because traditionally, quote unquote, that's not how it works. That's not what people do. People say, go for it, do what you want to do, and I'll follow behind you. And, we'll go here, there, and everywhere. So that was definitely difficult. And I think in those, when I've had quite extended periods in hospital, for example, we've been separated for long periods of time, especially during COVID, where we couldn't see each other. That was again very difficult on kind of a relationship basis of, is my carer checking in on me, or is my husband checking in on me? How does this dynamic work? My husband's ringing the hospital to check if I'm all right, but is he ringing as my carer or my husband? So it's sometimes those lines do become very blurred. But I think rather than seeing that as a negative, I see it as a positive, because again, it's kind of like building that trust of, that person really is, their primary thought is always, are you okay? And what can we do to make sure you're going to be okay for as long as possible? So although a negative situation, I think from an overarching perspective, it is a positive thing to see in the bigger picture.
Is that something, James, that you've been acutely aware of in terms of not feeling like you're sort of trying to parent Celia, and that you're keeping that, are you acutely aware of, I want to say this, but how do I frame that? Like, is that in your mind?
Yeah, I mean,
Yeah.
I think that I'm quite a direct person, let's say. So, we do try to, to suggest friendly suggestions. And then, when it gets to a point where a bit of a crunch point, then, I do like sometimes it can be maybe a little bit too direct with things. But and I think it works the other way around as well, where there's been, conversations where maybe, I've got a little bit too into work, and and I've just been going really, really hard at it. And Celia turns around and said, I just need a little bit of more support, at home, or even just normal daily tasks. So I think it works both ways. And I think we've learned to be, quite direct with each other. And I think that's probably,
Honesty is
for
the
us,
best
that works.
policy.
Yeah, and for us that
Yeah,
works.
you
That works.
can't. You can't skirt around the edges of it. You just
Yeah.
got to say it, because I think if you try and say things kind of in a roundabout way, trying to get your conclusion and your action takes a lot longer. And when you have a rare disease, sometimes you don't have longer to kind of make those decisions before things could go downhill. So just addressing it head on quickly is probably the best policy, and what's worked well for us.
Well, and that theme of trust is coming through really strongly, is that that underpins everything, doesn't it? And I know, Celia, you've
Mm.
spoken really candidly with us before, when we featured you in the Holistic Care edition, about the terminal nature of your condition and the sort of medical PTSD that you have associated with quite a catalogue of experiences. How does that play in terms of the level of support that you need from James? Because that can be quite acute, I know, for you at times. And how does that impact on your relationship?
That has, the physical challenges are one thing of, I remember when I came home with my Hickman line and we were staring at all these boxes, and I just started going into meltdown, and James was standing there, and I could see him out the corner of my eye being like, I have no idea what to say, because I don't even know what to do in this situation and how we're going to figure this out. But you can see kind of the cogs turning of him going, right, say the right thing, we're going to be all right, we're going to be okay. I think it's really difficult because lots of the experiences that I have are new to me and they're scary to me. James may not physically be going through it himself, but they're probably petrifying for James as well. And seeing anybody in pain, whether that's physical pain or emotional pain, if you love that person, even if that person's a stranger, invokes something in a human being that it's unpleasant for that person. So when it's someone, your husband or your wife or your life partner that you love dearly, it's very painful. And vice versa, when James has had, rough patches, it's incredibly painful to watch. And especially with mental health, where you can't take somebody to A&E and they can scan you and find the problem and fix it quickly, it's very difficult, because that it's quite a lengthy process, and not being able to have answers and know that there's no quick fix, and you've got to get through it and you've got to find a way to manage it, is very difficult. But then you throw into the mix the fact that, speaking from my own experiences, and I can't speak for everybody, but a lot of the time mental health and disability and rare illnesses go very hand in hand. But trying to find mental health support that understand that the vast majority of the time that mental health has come from a place of illness or chronic pain or whatever it may be, is very difficult. And we went through that, where we just couldn't find anybody to help me. And I was getting worse and worse and worse. And for James, that was we're in crisis, and he didn't know where to go because the resources actually didn't exist. So we felt very alone and very panicked about what to do. And it's very difficult as well, where the non-panicked one, i.e. James, starts becoming panicked. That amps up my panic, and we're all both just kind of sat there going, I have no idea what to do. But having that lack of resources of people that understand rare illnesses or chronic illnesses or illnesses of any kind, really, really takes a toll when you're talking about mental health, because even when I started getting the help that I needed, it wasn't the right help. And actually, it was just making me worse. But James is, listening to what a professional is saying, I'm going to make it better, I'm going to make it okay. Does he listen to the doctor or does he listen to me? And we now know that the person that knows the most about my condition is myself and James. And we have to take back that authority sometimes and say, no, this isn't right. But it's very difficult and very scary, because we can't scan and find it and fix it. That's what we're used to. That's what we know. That's how we know how to operate. We're definitely much, and thankfully I'm in a much better position than I was then. But we're definitely more kind of equipped, I think, both of us, to recognize when things like that are happening and have a bit more plan about knowing what to do, even if that's just something at home. We now know kind of what to do a bit more.
And coming back
It's
to you,
just learning. So much of
yeah,
it is learning together. Yeah.
absolutely. Just coming to you, just to touch back on that, James, in terms of that kind of looking to the future, is that something, and we're going to talk specifically about support in a minute, but is that something that you do find quite panic inducing? Are you able to voice your concerns with Celia, or do you feel you need to bottle that up because obviously you're trying to protect her from that kind of uncertainty as well?
Yeah, I think a bit of both, because there's no getting around it that some things you can't change, and so it's going to be rubbish. It's always going to be rubbish. It's not going to be good, but for a while. And so sometimes you just have to, it's just, rather than sort of trying to make it better, it's just accepting it, being there, and listening. Because some of this stuff you're not going to change, and it isn't going to change, and in fact some of it is going to get worse. So there's sort of I think there are certain people in the sort of support network that are there just to just to make us sort of a little bit happier and be kind and nice. And then there are some people that are actual, you have to be realistic sometimes and just go, this is actually this is actually happening, and it's not just one day they may find a cure, and it's like, yeah, but maybe they will.
Yeah.
But we still have to live up until then, even if they do. And if they do, it's very unlikely they will. So yeah, I think, and in terms of sort of future planning, I mean, for example, our house, it's sort of, we've sold it twice and not moved, and now we're selling it again, because we then, once it sort of gets down to it, we have our network here, we have we know the situation here, and we know that we've handled it previously. And so making a move sort of like that, and it's stressful for anybody, but like Celia mentioned earlier, for us, it's you also got 10 other things that you have to worry about too. And so that you have to plan everything quite meticulously, I suppose. Yeah.
Oh, great, thank
I
you.
want to come in on what James said there about not lying. And I think that's an important thing. And I think a lot of people who have similar, are in chronic health situations, there is nothing more infuriating than when someone says to you, it's all going to be okay, they're going to cure it, it's going to get better, there's going to be a procedure, someone will invent something. And that is not, for us, to speaking from my own experience, that's what I used to think I want to hear. But actually, I would find that in the longer term, that made things so much worse, because then I would sit there and be incredibly frustrated and think, why has it not happened yet? We're 20 years down the line. Why is none of these things that people are promising me are going to happen? And one of the big things for us is when we're learning how to deal with things, is we need to learn how to deal with it together. We both need to understand what's going on, and we need to be realistic. Like, when I got a new tube fitted or something like that, it's this isn't temporary, this is happening, and we need to adjust our routine. We don't need to kind of bounce around it and say, how can we make this work just for now? No, we need to embed this in our lives and work out how we do this. And not, if something amazing happens and there's a cure and it's all fantastic in the future, great, amazing, but let's not strive towards that. Let's strive to making things as best as we can in the situation we are in. And then if that happens, that's a bonus, it's incredible, it's amazing. But I definitely find that, reversing the conversation back to mental health, when James stopped telling me everything was going to be okay in the future, because I found that made me angry with him. because I think, why are you lying to me? Don't lie to me, because I know the situation and you know the situation. But it goes back to, again, being honest about situations, and also as the patient, not hiding anything from your partner and not feeling embarrassed, I think is a big one. Again, is there is nothing that James hasn't seen and been through with me. There are no boundaries that haven't been crossed. But that's also really important, because although you kind of preserve, you know, what you want to preserve in yourself, it's really helped us in those moments of crisis be able to deal with it head on, because nothing is shocking. We have to make things as unshocking as possible. Yeah.
And I think it's accepting, isn't it, that, you know, that sort of old thing about it's okay to not to be okay, isn't it? And actually a bit of acceptance, it's okay to sit in something and acknowledge that it really sucks and it's really difficult.
Mm-hmm.
And, you know, because I can totally relate to that frustration when it's the natural tendency for everyone to say it'll be okay, when, you know, if you know it's not going to be okay, that is really, it is difficult to hear. Wes, if I can come back to you, I mean, what sort of insights did you get from the participants in terms of the impact of that kind of future, looking to the future, and those elements of this?
We pretty much hit them where they are at this point in time. So you extrapolate a bit to pick up on that. But some of the things that they said, it resonates so well listening to Celia and James, where you know, I mentioned that people's time commitment were so great, but people also told us half the people said their marriage had difficulties due to taking care. 11% said their marriage failed. I mean, it's really heartbreaking things due to the issue. And unable to spend time with other family members, because, you know, there's other folks involved, and it's like you're spending time on the patient, there's less time for the others, which can cause, as you know, might cause other things. So, I mean, it speaks to how will we handle this in the future? How will they be able to go forward? So, and some of the, I love some of the, if I can be couple of quotes, you know, but we can't eat out at restaurants. It's difficult to travel or take vacations, you know, so it's things some of us take for granted. My daughter's schedule needs are the first to go into our schedule, and all other family and siblings needs trickle in. It's hard to manage. So you fill up your calendar, right? And then what's left over? Well, what is left over? Somebody said, my first marriage failed because my ex-husband would not or could not help. So some people just can't take it, for better or for worse. Of course, that's what you say in the vows, right? For better or for worse, but not necessarily. My husband and I have had to divide and conquer parent. So one parent could be with our other children and one could be with a child with a rare disease. So there's so many different coping things that people have done to get there. But I know that speaking of the future, somebody said, what am I going to do? I need to know how to set up people to care for her when I am gone. You know, think of a parent of a child, but then the parent will age and the child will age, and the parent will not be around forever. So many of our comments were from parents and children. The reason that is, I think, is as we defined rare diseases, so many of them were diseases of children. For example, dementia would have been the reverse situation, but that wasn't considered rare, and we didn't include it. But I'm sure if we did, you'd hear the kind of the flip of the coin for all those, you know, how that's affecting people's lives as well. And it's interesting too, where the situation with James and Celia, in general, we saw the reverse. So often it was the women taking care of the men. And some of that is simply because more women are willing to sign up and share their voice with us. But in general, the stereotype of women being more sharing seems to be true in that regard. But it's great to hear, because it obviously affects everybody of every gender and every age. This is not unique to anybody.